This is a tutorial of how to locate and utilize communication notes within the Access program. The purpose of a communication note is to keep the treatment team consisting of your fellow nursing colleagues and supervisors up to date on the client's recent changes. For example, med changes, falls, incident reports, infections, mental status changes, potential ER visits, or even hospitalizations. Keep in mind that the communication note is a permanent part of the record and goes into the patient chart. There are two methods for finding the communication note within Access. The first one is probably my preferred way, and that is within the note itself. So you would click on the nursing note. Now it would open up here. Now if you scroll down about 2/3 of the way down the note, you'll see Care Coordination section. Add Coordination Note, click on it, and that will open up the communication note. The second place is under Patient Charts. Click on Patient Chart. That will bring you here. Look on the right hand side of the page and you'll see communication notes. So I've already got, let's see, actually I don't. So I'm going to go back to the note. I'm going to add coordination note. It's going to open up a new one. Really the only thing you have to fill out outside of the communication text itself is the episode. So click on the appropriate episode, and then at that point you're going to fill in your message. So I'm going to paste this information in here. So this is just an example of a communication note. You could take some of the body of work done in your visit summary and just copy and paste it in here, obviously as long as it's accurate information. Because if you, let's say we use this example, patient reported taking pre-port evening medications in the morning, likely due to confusion, patient had a history of poor med compliance, and it is at high risk for hospitalization. Patient's memory and judgment are compromised. MD called and provided orders to increase patient skilled nurse visit frequency to twice daily. Patient is in agreement with this change to the plan of care. So that sums up why a communication note may be written. But you would also be putting that information into your visit summary. So you can take that information from the summary and put it right here in your communication note, just to save you some time. And once you're done, the last part of that is you're going to click this part here, send note as message, and it's going to give you a drop down box of all of the current nurses working at Relief. At that point, just check off who you want to send the note to. If there's scheduling should be involved, you want to update the scheduler. If you need to notify a supervisor, obviously make sure the supervisor knows, and then just let the rest of the treatment team, anybody who sees that patient, should be put on this message. So do that. You're going to sign it, put your date in, timestamp it, and hit complete. And that's it.